I'm Ed Haislmaier, Senior Research Fellow in the Center for Health Policy Studies at the Heritage Foundation. One of the things that President Obama has talked about being an advantage in his healthcare legislation is that it would eliminate all pre-existing condition exclusions and allow anyone to buy coverage no matter how sick they are.
This year, tens of thousands of uninsured Americans with pre-existing conditions, the parents of children who have a pre-existing condition, will finally be able to purchase the coverage they need. That happens this year.
It's true that the imposition of pre-existing condition exclusions is still a problem in the individual market, but that's only where 10% of Americans get their coverage. The other 90% don't have that problem because of a federal law that's already been on the books for 14 years and applied to the employer insurance market. What federal law already said before the passage of ObamaCare was that if you had health insurance coverage and you got new coverage from an employer, that the employer or the employer's insurer could not impose a pre-existing condition exclusion on you, had to give you the same coverage, and couldn't charge you more than any other employee. That was already federal law. The problem was that those rules weren't applied in the individual market. Now that can be fixed. It's easy to do. I've recommended doing it, and it only takes 2 pages of legislation, not 2,700 pages. Under previous federal law, and under the changes that I propose making, the only people who would face pre-existing condition exclusions would be those who did the wrong thing, waited until they were sick to buy health insurance. Instead, the President's legislation would allow everyone to wait until they're sick to buy health insurance. The only way he can even try to make that work is with a new individual mandate. If we instead repealed this legislation and replaced it with some common sense, simple insurance market reforms that give everyone who buys coverage credit for that and eliminates pre-existing conditions for them when they switch coverage, as is now the law for employer plans, then we wouldn't need this legislation and we wouldn't need a mandate. To see more videos like this one, please go to fixhealthcarepolicy.com.